question comes up often from ladies who are either pregnant or, in Cindy's case now, post-pregnancy. She's the proud mother of twins, 10-month-old twins, right? They're very cute, but we're not gonna show them on camera, but they might make the occasional noise as we're filming this. But the question is, can patients do Botox and dermal fillers during pregnancy or breastfeeding? And the answer, you might guess it, is no. The answer is no. Now, it is a little bit nuanced. I don't want to get into too much of a detailed answer here, but long story short, the studies have never been done to establish the safety of Botox and fillers in pregnancy or breastfeeding. So because the studies have never been done, the short answer is basically to not have these products administered during pregnancy and breastfeeding. But the good news is you can use high quality medical grade skincare. Now there is a caveat there, Cindy, as long as you're not using any hydroquinone. So hydroquinone based products, which are used to lighten the skin, but hydroquinone has been shown to be able to spread systemically or in the breast milk. So we gave you specifically a non-hydroquinone pigmentation kit from Vivier, which will help brighten and lighten the skin, get rid of some of the pigment issues, and it will give you that sense of skin vitality without the use of injectable treatments until you're ready for Botox and fillers.